Now to a KOIN 6 follow-up, and this is an issue we have been following for years.
Yeah, Multnomah County reversing its stance on inaccurate information the county chair presented during a pivotal board meeting about the ambulance crisis.
Our investigator reporter Elise Haas here now, the only reporter to challenge the chair in her August 15th report. And I know you were able to do this based on your reporting over the past year on this major issue.
Yeah, so I knew the moment that the chair made that claim that I had documents on my computer and on the record recordings with AMR that would prove her statements false. Within minutes of her making the public comments, I made records requests for her proof. And it turns out there is none. And now the county is saying sorry. After nearly 2 years of fighting over a solution to the ambulance crisis, this is the statement Multnomah County Chair Jessica Vega Pederson made in an August 15th public board meeting that was not true.
Before this mediation began 6 months ago, we were in a very different place with AMR than we are today. AMR's February proposal to this board was 100% hybrid ambulances. No ambulances on our streets with 2 paramedics and 0 BLS ambulances.
Yet, through months of investigation, we already had a copy of AMR's February proposal that clearly stated their request was to only move half their crew to the hybrid system of 1 paramedic and 1 EMT, not 100% of the force Vega Pederson claimed during this month's meeting. We even aired this clip of AMR leadership, saying it publicly 7 months ago on February 1st.
We're confident we're at the point now where there really is only one pathway forward to sustainability in EMS in Multnomah County.
And what is that?
That's going to be going to half of our total deployment being paramedic and EMT rather than dual paramedic.
The chair's inaccurate statement derailed the county board meeting, which devolved into arguing over the facts of the previous proposal. When challenged by Commissioner Sharon Myron during that meeting, the chair and the health officer, Dr. Richard Bruno, doubled down that they had documents to back up their claims. But 8 days later, after we made multiple requests for their proof, Dr. Bruno admitted they were wrong, saying in part, "I want to apologize for any misrepresentation. AMR did submit a proposal on February 12, 2024, as referenced in KOIN's previous reporting. The proposal estimated that half their fleet would need to be converted to a hybrid 1-1 staffing model to meet response times. Separate from our records requests, we also obtained internal emails from Multnomah County policy advisors acknowledging the misleading information, ending with, the health department is communicating a correction and regrets to AMR directly." Since last Friday, we reached out to the county chair multiple times requesting an interview. Her staff declined, saying that she wasn't available today, but they did send a statement from her this afternoon saying in part, when the misstatement of an element of AMR's February proposal came to light following the August 15th meeting, it was important to correct the record and hold ourselves accountable to providing accurate, updated information, which we did through a correction to our board and to AMR directly. Though she doesn't explain how her misstatement happened, it's important to note that it took more than a year for the county chair to agree to essentially the same solution that AMR proposed from the get-go.
And I do want to point out, this is all while over the past year in your reporting, Elise, you've shown us how people in our community, there are patients, firefighters, and so many more who had these emergency situations that were negatively impacted because of this ambulance shortage.
Yeah, I broke stories about how people had to get transferred to the hospital in a TriMet bus, or again in fire engines because there weren't any ambulances available to help them at that time. So really, it's the county chair played a big role in these very pivotal situations for ambulance services, and you know it's gotten to this point here today.
Yeah. All right. Great reporting once again, Elise. Thank you so much. Holding our leaders accountable, a very big topic. Thank you.
And as we said, if you want the very latest on this entire episode of stories that Elise has been pushing for well over a year now, you can follow her extensive reporting at KOIN.com. Just search for Emergency on Hold.